Hi, I'm Dr. John Ross, Ross Chiropractic. I've been in practice for about 30 to 34 years. I have developed my own technique for handling people that are in acute and chronic pain. We call this the Ross method of chiropractic. It is designed to get people out of pain as quickly as possible. We use a technique that is very mild for the patient. There's no discomfort to the patient, and the treatments are relatively fast per visit. I would much rather see patients in a preventative mode. In other words, come in when you're not hurting. Let's determine exactly what kind of condition your spine is in, and then we can determine what kind of preventative care you can have for the future to head off the pain rather than waiting to come in when you're actually hurt. This represents what is a normal spine. This is a motor unit, 2 segments in the spine consisting of a disc, 2 vertebrae, and an opening for the nerves. At some point in people's lives, they'll have a mild injury that causes the disc to start to become inflamed, gets a little red, begins to dry out the disc begins to shrink, the opening for the nerve begins to shrink. Therefore, they develop periodic achiness, stiffness, mild discomfort that might affect them for a day, 3 days, something of that nature, then it goes away. Eventually, the attacks get more frequent, the disc begins to wear out, the disc dries out, spurs begin to develop. At this point, the patient may have attacks that last a little bit longer, but they may in fact still go away. In the final stage of degeneration, the spine has completely fused. This has undergone natural fusion. At this point, the people have long-term permanent problems. We want to try to prevent them from getting to this stage. I'd much rather see them between what we call stage 1 and stage 2 so we can add years to the life of their spine. If they come in stage 3, primarily what we're going to be doing is trying to keep them comfortable so they can function day to day.
I started getting adjustments, and I just started feeling better and could move better. I didn't realize that I was overcompensating for these problems that I had by not walking correctly and not moving correctly. And actually, my pelvis was rotated, and I didn't know that. So he put a lift in my shoe to make me walk more level, and so therefore my back quit hurting.